Thank you for joining me today, dietitian nutritionist Emilia Subev, helping you lose weight and improve your gastrointestinal function. Today, I'd like to help those of you using acid suppressive medications understand how those medications could be affecting you in a long-term use. So these medications, as you know, are one of the most prescribed medications in the US. They are even readily available over the counter. Omeprazole, Protonix, Pepcid. There's several of them that you can obtain without even a prescription and use them as needed, or you might use them every day. However, when they were first discovered, those medications were recommended to be used only for short term. Now I see patients using them for years, maybe even 20 years. They are using them and they wonder why their gastrointestinal function has declined to an extent where they might develop bacterial overgrowth, they might have constipation, diarrhea, might have malabsorption, or other gastrointestinal issues. So the very first side effect I'd like to discuss after a long-term use is interruption or disruption of the gastrointestinal function. So hydrochloric acid is produced into the stomach by the parietal cells for a reason. It is there to help you digest your food. It is there to make the chyme, and by chyme I use a term that we use for a food that is not digested, that is within your stomach, and it has turned into a soup because your stomach does that. It turns the food matter into a soupy consistency. It dissociates the bonds, but nothing is really absorbed in the stomach. However, your food or the chyme is being mixed with the hydrochloric acid. And when the chyme mixed with hydrochloric acid arrives in the proximal, the first part of the small intestine, where all the digestive processes are happening, the chyme diluted in hydrochloric acid is mixed with all these basic enzymes, the digestive enzymes that are produced by the pancreas and the liver. And this is how normal absorption of food happens. The acidic chyme meets the basic enzymes, and then all the food that you consume is being absorbed and utilized by the body so it can feed you and nourish you. However, when the hydrochloric acid production is being blocked by the PPIs, which really block the production of the hydrochloric acid within the proton pump, that's why they're called proton pump inhibitors, then the chyme arrives in the proximal small bowel not exactly acidic as it should be. And some foods particles might be left there behind undigested, right there in the small bowel, lingering around and providing nutrient and food for bacteria that shouldn't be there. We inherently shouldn't have a lot of bacteria in the small bowel. All the bacteria, good or bad, should reside mostly in the colon. However, for some reason, there might be a little bit of bacterium in the small bowel, and usually it doesn't survive and get flushed down the pipeline, and we stay healthy. However, if we provide food for that bacteria by a chyme that is not acidic enough, then a condition called small bacterial overgrowth, or SIBO, might happen. So after a long-term use of PPIs, someone may present with bloatiness, excessive gasiness, diarrhea, abnormal stools, pressure into the stomach. They might present quite distended as a woman that is pregnant in the 5th month. So this is a classic presentation of small bacterial overgrowth, and that condition normally happens because of something else, and long-term use of acid suppressive medication is one of the reasons why this can happen. Another side effect that is again gastric effect is slow digestion within the whole system, and so constipation can happen. Very often nausea and vomiting are also associated with the use of those medications. Number 2 side effect is malabsorption of certain nutrients. So for example, vitamin B12 needs specifically acidic environment in order to be absorbed. When the environment into the stomach is not acidic enough, vitamin B12 is not able to be absorbed. There's another substance that needs to be activated called intrinsic factor, and this intrinsic factor only is able to dissociate vitamin B12 from its protein associates that are carrying it around in a very acidic environment, pH between 1 and 3, which is the normal pH for the content in the stomach. When the pH is higher, then vitamin B12 is not able to be absorbed. So if you are a chronic user of H2 blockers or PPIs, it is better to actually take a larger doses of vitamin B12, or even intramuscular B12 might be a better idea for you. Another nutrient that requires acidic environment is iron, especially if you're vegetarian or vegan. The iron source in vegetarian food is non-heme iron. Non-heme iron also requires acidic environment in order to be absorbed. If you are vegetarian using acid suppressive medications, you might actually develop iron deficiency anemia. Another nutrient that requires acidic environment is calcium. So calcium needs to be made more bioavailable, more soluble by the hydrochloric acid in the stomach. So this is the reason why people that are using PPIs and H2 blockers for extended period of time might develop fracture or low bone density. So you need to either increase your calcium absorption or choose supplements that are chelated, which are easier, more bioavailable for you to use if you are using PPIs or H2 blockers for extended period of time. There are a couple of studies that are associating zinc malabsorption and zinc deficiency with the long-term use of those medications, both from supplements and from food. So if your overall total body stores of zinc are decreased, that might affect your immunity. So you might have decreased immunity related to lower than optimal zinc status. There have been reports of increased risk for kidney dysfunction or development of chronic kidney disease with the use of PPIs and H2 blockers. The mechanism of how this happened hasn't been yet determined. However, there is clearly association between the two. At this point, more research is needed to clarify how this actually is happening. Some central nervous system dysfunction and irregularities have been associated in particularly with the use of H2 blockers. Confusion, loss of cognitive function, some disorientation, and actually those studies found that people that are long-term users of H2 blockers have much higher risk for development of Alzheimer's or dementia at an older age. Lastly, rebound hypersecretion of hydrochloric acid can happen if you abruptly stop these medications. So if you are using them for extended period of time, your body has used to you not producing as much hydrochloric acid. And if you decide to stop them tomorrow, you might experience hypersecretion or very, very high secretion of hydrochloric acid in your stomach, which will result in severe GERD and gastroesophageal reflux disease symptoms. So if you decide to wean off of those medications, you need to do it slowly. My approach is, if someone is using PPIs, which are the stronger type, I recommend that they change to H2 blockers for some time. And while they're changing that, and while they're transitioning from PPIs to H2 blockers, they need to adhere to the GERD recommendations, or what I call the GERD diet. Remember, that was avoiding alcohol, avoiding caffeine, avoiding spicy, avoiding acidic, eating small meals, not eating fried and fatty foods which stay longer and linger longer in the stomach, not laying down after dinner for at least 3 hours to allow the food to leave the stomach and propel down the pipeline. Along with all these recommendations, of course, diaphragmatic breathing exercises to allow the strengthening of the lower esophageal sphincter and repair the dysfunction that might be associated with the GERD. So all managing symptoms with supplements and mindfulness, meditation, acupuncture, everything you can do really supporting your system in order to rely mostly on yourself to repair the damage that could have been caused from long-term use of either the medications or the gastroesophageal reflux disease itself. So really, the transitioning from those medications should take time, and while you're weaning off, you'd like to do all the dietary interventions, all the exercises, the diaphragmatic breathing exercises, and use the supplementation, manage stress, and practicing mindfulness, meditation, acupuncture. All these techniques will help you, support you along the way. Once you transition off the PPIs and go to H2 blockers, then you might decide to do H2 blocker every other day or as needed, and then from there on add more supplements, use more supportive techniques. Cabbage juice have been used with great success in alleviating GERD symptoms. Look at the description below for more information about that and to find the supportive literature where you can see how this technique was discovered in the management of GERD. So to sum up, please be advised that the acid suppressive medications are not harmless. Do not rely on them for a long-term use in order to manage your GERD. Your GERD can be managed with diet, lifestyle, and other supplements much more effectively, and you can change the function of your gastroesophageal sphincter effectively with long-term diaphragmatic breathing. So be sure to understand that the acid suppressive medications are not benign, and the side effects could be quite serious.